It has been an active flu season and at a time really straining our hospitals.
But we may finally be seeing some improvement. Onondaga County Health Commissioner Dr. Katie Anderson is joining us. Good to see you.
Thanks for having me.
Last time we saw you, you were pretty concerned about the number of flu cases in Onondaga County, and there was even a press conference about it, and you were kind of sounding the alarm. Cases are up, ERs, it's not good. What's the situation now?
The good news is now we seem to be past peak. So our flu cases are trending down, hospitalizations are trending down, and our hospitals can breathe a little bit. But as we know, our hospitals here and nationwide are strained even on a good day. But cases are trending down. But what I would say to people is, even when we're past peak, we still have a lot of flu season ahead of us. It's going to continue well into April or May, so if you have not yet had your flu shot, it's still time to do that. We may have more than half of our cases yet to come. But the other thing I'll mention is relative to the alarm that we sounded is including flu, but beyond flu. A good goal for everybody in 2026 is if you don't have a primary care, it's a good time to get one so that next time you feel like you need to be evaluated but you don't need to go to the emergency room, it's better for you and it's better for our system if you have a primary care in place.
Yeah, which leads me to this, and you mentioned that at that press conference, who really should and who really shouldn't be going to the hospital in terms of flu anyway? Let's just keep it right there.
Yeah, so for flu, most cases can be handled at home and people can recover at home without even needing to be evaluated by a physician. If you're high risk, that's when you may want to see your physician or go to an urgent care. But the ED should ideally be reserved for true emergencies. So that would be people who are having chest pain, having trouble breathing, who are confused or hard to wake up. So ideally, in an ideal system, we'd be reserving the emergency room for those people who really need to have emergency care.
Let's switch to another topic. The CDC a couple of weeks ago cut the number of vaccines that it recommends for children. Very confusing for parents right now. What advice would you give to parents as far as getting vaccines for your kids?
So that's right. Recently, at the suggestion that we decrease the number of vaccines in the childhood schedule, and this wasn't based on any new safety data, any new concerns about effectiveness, there was a federal recommendation that we decrease the number of routine vaccinations for kids from 17 to, I believe it was 11. And that includes some pretty serious diseases like hepatitis B, hepatitis A, meningitis. And so the concern with that is that one of the guidance was that we should align ourselves with other developed nations like Denmark. Denmark comes up a lot. The challenge is we're not really like Denmark. Our health system is totally different. We have a lot of gaps in our system. We have a lot of people who can't access care, back to the point we were just talking about. And so this recommendation, importing a guidance from another country with a different healthcare system, is likely to result in preventable disease and some resurgence of these infections. What it means for people locally is actually not much has changed. New York State and other states have the liberty to set their own childhood immunization schedules. Requirements for schools and the recommendations in New York State, and we agree with this, have not changed. Those same vaccinations are recommended. They're still available and they're still covered by insurance.
You're getting the information out this way. I want to ask you how much of a priority that's going to be for your health department this year to get public health education out there, whether it's vaccines or it's other healthcare issues.
That's a really important goal for us for 2026, because even if the recommendations and the requirements, let's say for vaccines, have not changed in New York State, what has changed is that it's really confusing to people to know what is the right information, especially when the CDC, our former go-to for evidence-based health education, is putting things out that are confusing. So a big goal for us for 2026 is to be very visible, to make sure people understand what public health is, why it's important, and in the case of things like vaccines, help people understand what is the data, what do they need to know.
And what's the easiest way for people to reach out and get that credible information?
So if they want to educate themselves, they can go to our website, the county website, New York State Department of Health. They can go to societies like American Academy of Pediatrics. If they have any questions, they can reach out to us directly, and we're here to support them.
As part of that, maybe not necessarily specifically education, but a connection to programs and services that are out there. Sometimes people don't know what's out there, or we saw SNAP go away for several weeks, and they may not know where to turn. Does that now fall under your department? Not now, but falls under your department, and is that also a big priority for this year?
So it's a priority for us this year in that a lot of people are accessing, the same families are accessing a multitude of different services that are likely going to become harder to access in 2026, unfortunately. That includes requalifying for Medicaid. It includes accessing SNAP benefits and other benefits. So a goal for us, others in the community, others within the county, are to break down these silos and really try to make things more fluid and streamlined for people. So this is an unwelcome priority for us, I will say, that things are going to be getting a little bit harder for people, but it could be actually a good outcome if it makes us all work together and make things easier for our families.
All right, Dr. Katie Anderson covered a lot of ground. We appreciate your advice, your guidance, as always. Thank you for joining us tonight.
Thank you.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.